Vethaan channel.
வாழ்க வையகம் வாழ்க வையகம் வாழ்க வளமுடன். குரு வாழ்க குருவே துணை. Today we are going to say about that female pelvis. First we'll see that introductions. And that female pelvis aids in childbirth. It is a skeletal ring formed by two innominate hip bones and one sacrum, one coccyx. It is a bony canal in which fetus must pass through during the time of delivery. In female pelvis used for that childbirth, at the same time, there is a ring-formed skeletal bone. It consists of four bones, that is, two innominate or hip bones, and one sacrum, one coccyx. These four bones are consist in that female pelvis. It is a bony canal which fetus it is passed through the through the pelvis during the time of the delivery. It's having that classification of pelvis. It's having four classification will be there. First we'll see the gynecod pelvis. In that gynecod pelvis is an female pelvis because it's occur more frequently in small per woman. It is a rounded, slightly oval inlet. Gynecod pelvis is a female pelvis. Gynecod and pelvis is a female pelvis. It occurs more frequently in small for woman. At the same time, it is a rounded in shape and slightly oval inlet. In that rounded and oval shape only, it is giving to that baby pass through the pelvis. There is a way to give the pass through the pelvis. And this type of pelvis only is present in the female pelvis. If suppose other pelvis will be there means and in the mother is getting the normal level is difficult. And second one is anteroid pelvis, and that anteroid pelvis is a typical male pelvis. Pelvic brim is a heart shape and favors posterior position of the fetus, narrow pubic arch. This type of anteroid pelvis present for the male pelvis. Pelvic brim it's heart shaped, but in that female pelvis it's a rounded and oval shape. In that it is heart shape would be present in the anteroid pelvis and favor posterior position of the fetus. At the same, if it is anteroid pelvis is there means that fetus position will be a posterior position. It's a favor pelvis. At the same time, narrow pubic arch. The pubic arch will be there. No, that is 90-degree will be present in that female pelvis. Here in the anteroid pelvis is having that narrow pubic arch. And next anthropoid pelvis. Anthropoid pelvis is having 25% white woman and 50% non-white woman. It is having straight pelvic side walls and pelvic brim is having increased anteroposterior diameter. In that anthropoid pelvis having 25% of white woman, at the same time 50% of non-white woman will be there. It is having straight pelvic side wall. That's here you can able to see that that anthropoid pelvis. Here will be present that is straight side wall. Side wall will be straight. And this is a gynecod pelvis. This is a rounded and oval shape will be present in that. This is the way to pass the fetus easily through that gynecod pelvis. And next one is anteroid pelvis. Anteroid pelvis. This type of pelvis is having for the male pelvis. And next is platyploid. Platyploid pelvis is having 3% of women. In this type of pelvis having pelvic brim increased transverse diameter. Here in that pelvic we will see later in the brim and all brim cavity outlet will be there. Brim as well as into that inlet also can able to see the brim. In that brim it's having the transverse diameter, it's a increase compared to that others. It is transverse diameter will be a increase in the type of platyploid pelvis. This is a platyploid. This is a transverse diameter. Transverse diameter is a increase in the brim. These are all the types. And next we'll see that detail about gynecod pelvis. In the gynecod pelvis is found in 50 to 55 percentage of women. Mostly women it's having in this type of pelvis. It has slightly oval inlet. It is a oval inlet. And gynecoid pelvis is having not prominent ischial spine. The ischial spine means it's not having prominent, means that is it's not in that the other it is not having lesions, like it's not having, but it is having that uh, slightly in that less sharpness. And this structure facilitates the passage of the fetus during labor and delivery. This structure is using to fetus to deliver the baby. And next we'll see the types of pelvic bone. In the types of pelvic bone, it's having that innominate bone 2 and one sacrum, one coccyx. That already we saw that one. Gyneco type of pelvis is having that two innominate bone, one sacrum, one coccyx. In that two innominate bone consists of three parts. That is that ilium, ischium, and pubis. The three parts it's having in that one innominate bone. Each and every in each innominate bone it's having that three parts: ilium, ischium, and pubis part. First we'll see that ilium part. In that ilium is the largest portion of the innominate bone. Upper border of the ilium is termed as the iliac crest, and the greater part of the inner aspect in smooth and concave forms is the ilia fossa. Here, this is the female pelvis, that is a gynecoid pelvis. In detailed structure will be there here. Here it is having that this is innominate bone, and this also it's a innominate bone, and this is a sacrum, this is a coccyx. This innominate bone it's having that ilium part this one, and ischial part this one, and this part is a pubic bone. This is a pubic bone, this is a pubic bone, this is a ischial bone and ilium. This three part it's having that one innominate bone, and sacrum this is, and this is a coccyx. Here in that largest bone of that innominate bone is ilium. Ilium is the largest part of the bone. Upper border of the ilium, it is called as iliac crest, where we can, while we are standing, that time we are keeping the hand in that hip, no, that this part it's a iliac crest. And next greater part of inner part of aspects, that is a smooth part, its concave forms will be present here. This is the iliac fossa. This is iliac fossa. In that iliac crest, anteriorly end in that anterior superior iliac spine. This is the anterior superior iliac spine, and posteriorly same it will be present in this, and posterior superior iliac spine. Posterior is back side, superior means upper. So posterior superior iliac spine will be present. Below the anterior superior iliac spine, one iliac spine will be present, that is the anterior inferior iliac spine. This is the anterior inferior iliac spine. Same it will be present in the back side. It is the posterior inferior iliac spine will be present in the posteriorly. This is the posterior part. In that ilium is a concave shape. It is the lower most of the part in the ilium forms is the acetabulum. In that if you are seeing that five part in that ilium, ischium and pubis, in that two by fifth part is it's present in that acetabulum part is ilium part. 2 by 5th of part it is acetabulum it's present. And behind that ilium forms upper part, large nodes will be there. This is the large nodes. This is called as greater sciatic nodes. It is end with that posterior ends in that inferior iliac spine. Posterior inferior, it starts from the posterior inferior iliac spine, and greater in that greater curvature we can able to say that the end of the greater curvature, and that will be present in the greater sciatic notch. And next, on the inner aspect of if you are seeing that inner part, this is outer part. If you are seeing that inner part, in that inner part, iliac fossa, here in that iliac fossa will be there. From the iliac fossa, it is continuation, one line will be there, that is the iliopectineal line, and that where it will be joined that superior ramus and the ilium, and eminent spots will be there, that is the iliopectineal eminent. After the completion of the iliopectineal line, that is iliopectineal eminence will be present. In the iliacus, anterior ends in that anterior superior iliac spine, and posterior ends at that posterior superior iliac spine. In the below the anterior superior iliac spine, another bony prominence is called as anterior inferior iliac spine, and similarly the posteriorly ends in the posterior inferior iliac spine. It is all will be present in that present between that iliac crest. And next, ilium is concave in shape. Of lowermost part and the ilium forms 2 by 5th of acetabulum. Acetabulum is the receiving of the femur head. It is having behind the acetabulum. Ilium forms the upper part of the large nose, is called as the greater sciatic notch. Its posteriorly ends with the inferior iliac spine. If you are seeing that inner aspect of that gonocard of female pelvis bone, the iliac fossa is bounded. It's known as iliopectineal line, and that ilium fuses with that superior ramus from the iliopectineal line to iliopectineal eminence. Then it forms the superior ramus of the pubic forms. This eminence means Allah knows that is a which part it is a bone it's developed, that is the eminence. So after that, and in between the iliopectineal line and superior ramus, it's having the iliopectineal eminence. Next part is ischium. Ischium is the lowest of the bones of innominate bone, and head forms the lowest 2.5 of the acetabulum, and it fuses with the ilium and pubis below the acetabulum, and thick vertex of bone passes downwards and terminate ischial tuberosities. And lower bone, when we are sitting, that bone also can feel in the sitting, no, and that bone it is ischial tuberosity. And next, it is the part of the pelvis on which the weight of the body rests on sitting. The ischial tuberosity only it uses to sitting on the body and rest of the body, and passing inward and upward of ischial tuberosity. A small shift of ischium continues with that inferior ramus of the pubis forms pubic arch. In that inferior ramus, already we saw this one. Here we can able to see this. This is that superior ramus, and here we can able to see that inferior ramus. This superior ramus and inferior ramus forms that pubic bone. It will be formed in that. Here this is that ischial part. This is the acetabulum. This we saw, no, that is the ischial tuberosity. This is the ischial tuberosity. Ischial tuberosity. This bone it's used to sitting and rest of the body. And next, ischium forms lower boundary called as obturator foramen. This ischium it's having, it is a bond of the ischium. It is a superior ramus, inferior ramus, and ischial tuberosity is forming one holes will be present. This is a obturator foramen. Then we'll see the pubis. Pubis is the smallest of the bones forming in the innominate bone, and pubis is a square shaped. The pubis bone is a square shaped when it is forming a superior ramus and inferior ramus. It's forming as a square, and it joins between the two pubic bone is called as symphysis pubis. And this is present in that if you are seeing here, this is that pubic bone, two sides will be present. This joining that pubic bone, it's called that symphysis pubis. And next we see that upper surface of the body forms pubic crest, and laterally ends in the pubic tubercle below the body of the pubis, forming the pubic arch. It is it pubic crest. It is a pubic crest and indent is the pubic tubercle, and this is the pubic arch. It's a forming pubic arch. And next we'll see that sacrum lies in the posterior part of the pelvis. It articulates in the iliac portion of the two innominate bone and bones, and it consists five sacral vertebrae. Sacrum is a concave in shape and anterior surface is a smooth. Lower margin of the sacrum forms a small smooth surface. It articulates with the coccyx. Sacrum is lie in the posterior part of the pelvis. It is the back side of the pelvis. This is the sacrum. It is the posterior part of the pelvis. It connect with that two innominate bone. It connected the both two innominate bone and consists of that five fused. The five sacral vertebrae means it only one bone, but it is fused in that five fused vertebrae. It's present. This it is having concave shape. It is having the concave shape in inner side, and anterior surface it's a smooth. In lower margin, if it is in that lower of the sacrum, it's formed in that coccyx. It is a small smooth surface of articulates. Means it is connected that small smooth surface of bones is present. That is a coccyx. In that coccyx bone, coccyx it's consist. Coccyx Coccyx consists of four fused coccygeal vertebrae and the coccyx in triangular shape. First coccygeal vertebra articulate with lower and sacrum at the sacrococcygeal joints. The coccyx is present. If you are seeing that coccyx, in this coccyx consists of four fused. Sacrum we saw that it is a five fused, and coccyx is the four fused bone. This is a triangular shape. This is a triangular shape bone, and this first coccygeal vertebra articulate in the lower in the sacrum. It is connected with the sacrum. This coccygeal bone connected with the sacrum. This is connection is the connected joint. Its name is sacrococcygeal joint. And next we see that pelvic joints. It's having the four joints it's present here, like it is in the orange color. You can able to see this is that sacroiliac joints it's present between the sacrum and ilium. This is present in the sacrum and ilium. It's present that in between sacrum and ilium is called that sacroiliac joints. And sacrococcygeal joints, already we saw that the joint present between the sacrum and coccyx, sacrococcygeal joints. And the another one is joint, it is one symphysis pubis joints. It begins joints between the two pubic bones. Both pubic bones joints in that one joint, and that is symphysis pubis. These four joints, two sacroiliac joint and one sacrococcygeal and one symphysis pubis. These four joints it's present in the female pelvis. And next go for that ligaments. In the ligaments it's having that five main ligaments it's present. That is uh, in this ligament, sacroiliac ligaments that join the ligaments from sacrum to ilium front and back. And sacrospinous ligaments, that is a ischial spine, that is a ischial spine will be present, that is from sacrum to ischial spine, that ligaments will be present, that is a sacrospinous ligament. And next is tuberous ligaments, that is from sacrum to ischial tuberosity ligaments, it's a joining, that is the sacrotuberous ligament. And next pubic ligament. In that pubic ligament it's having that joining the pubic bone front and back, it's having, that is a pubic ligament. And sacrococcygeal ligaments, that is present between the sacrum to coccyx, there is a front and back of the ligament will be present. This is sacrococcygeal ligaments. Total it's having that five ligaments it's present. Now we'll see that the inner aspect of the pelvis. That inner aspect of pelvis, it's having the three parts, that is a pelvic brim, cavity and outlet. First we'll see that brim is round except where sacral promontory project on into it. The promontory and wing of the ala form a posterior border iliac bones, and its lateral border, and the pubic bones and brim is 55 to 60 degree above horizontal. If you're seeing in the pelvic structure, this is a part we can able to say that the pelvic brim part. This is the outer, means the upper part of the pelvis is the brim part. This we can able to see, and that in that brim part we can able to having that landmarks of the pelvis. Now we'll see that landmark of pelvis. What all the landmark will be present in that pelvis. So first one is that landmark of pelvis is sacral promontory. Sacral promontory is the first landmark, and alar wing, sacral wing, alar wing it's the second landmark, and third one is the sacrococcygeal joints, and this is the iliopectineal line. It will be present here. Iliopectineal line it's the fourth one, and fifth one is where it is joined that superior ramus and ischium part. It is having eminence part, that is it. And next landmarks, and next superior ramus of the pubic bone is that next landmark, and next upper inner border of the pubic bone, where it is having that end of the pubic bone. Upper inner border is seventh, and upper inner border of the symphysis pubis. This is the eighth landmark will be present in the pelvic inlet. This landmark sacral promontory, sacral wing, alar wing, sacroiliac joint, iliopectineal lining, iliopectineal eminence, superior ramus of the pubic bone, and upper inner border of the pubic bone, and upper inner border of the symphysis pubis. And next is the pelvic cavity. Pelvic cavity extends from the brim above the outer below the anterior wall. It is formed by the pubic bone, and symphysis pubis posterior wall is formed by the curve of sacrum. It is having that front part. If you are seeing the front part, it is the symphysis pubis part, and back part, posterior part, it is the sacrum concave shape will be present. In that inner above that brim will be present. Then brim, if you are going to the brim inner that is coming to the cavity part. In the cavity it's having the curved canal. It is a curved canal. This cavity is a circular shape. This cavity is the circular shape. It's having a diameter, or it is equal in that transverse, anteroposterior, and oblique diameter is equal, and it means 12 centimeter. So it's having the circular shape present, so when it's having the diameter is 12 centimeter. And next you seeing that pelvic outlet. In that pelvic, it is that lower part of the true pelvis. It is formed by the lower border of each of the bones. If lower part, if we are sitting, that ischial tuberosity will be present. No, that part we can able to say that outlet part, and that each of the bone it's a lower part only. And next the pelvic outlet is a diamond shape. It is a diamond shape represent. Obstacle outlet is that greater practical signals. Because of obstacle outlet means because of the baby head is delivered in that part, so only it is obstacle outlet. It is a important of the practical significance. This is the next we'll see the diameter of the pelvis. This is diameter of the pelvis. We can able to say that is a brim. Brim anteroposterior diameter is that 11 centimeter. It starts from the sacral promontory to upper inner border of the symphysis pubis. It is 11 centimeter. And next oblique diameter is the sacroiliac joint to iliopectineal eminence. Sacroiliac joint to iliopectineal eminence is oblique diameter. Right and left oblique diameter it's having the 12 centimeter, and transverse diameter is present between that iliopectineal line. It is present both the sides having iliopectineal line. It is having the 13 centimeter. It's a brim. And next go for that cavity. Already we saw that cavity is that oval round shape, circular shape. So let's having only the 12 centimeter of diameters in the cavity. And next go for that outlet. And that outlet it's having that anteroposterior diameter is that 13 centimeter. It starts from the tip of the sacrum, lower border of the sacrum, tip of the sacrum to lower border of the symphysis pubis. Tip of the sacrum, why we have to take it mean, because of in the during the time of delivery the pubic bone it's getting back, it is a movable bone, so we can't able to consider that the point. So only we are taking that sacral in part, it is taking the anteroposterior diameter. From anteroposterior diameter to symphysis pubis is the 13 centimeter, and oblique diameter it's starting from the obturator foramen to sacrospinal ligaments. Sacrospinal ligaments it's present from sacrum to spine will be there is scale spine. From the center of the sacrospinous ligament to obturator foramen will be present. So opposite side we have to take it that is oblique diameter, the right oblique and left oblique, that is the 12 centimeter of the pelvic outlet. And next, if you are seeing that transverse diameter is present between the two ischial spine will be present is back of that, so that is the 11 centimeter. This is that pelvic diameters. Next topic we'll see that pelvic inclinations. Pelvic inclinations, also known as pelvic tilt, refers to the angle of pelvis relative to the horizontal plane. That is the sacrum. It is sacral angle will be changes will be occur in the type of pelvic inclinations, and it can be measured as the angle between a line connecting the anterior superior iliac spine and a vertical line. It is having that we have to take the measurement that angle between a line of connecting the anterior superior iliac spines angle we have to take it. If you are seeing this, if you're seeing these images, this is a neutral, that is the anterior posterior superior iliac spine, and this is anterior superior iliac spine. So we're taking the angle, it is at normal, it is giving the position. But in the, if suppose that pelvis it will be present in the posterior pelvic tip, means that is pelvic tilt, posterior part of pelvic tilt means that it is coming to the back. That is, if you're seeing that this is a posterior superior iliac spine, and if you're seeing that anterior it's going to up, and anterior pelvic tilt, if you are seeing that anterior superior iliac spine it's coming down, and sacrum it's going to up. So this is a posterior pelvic tilt. Posterior means that is it's on the sacrum, and bones is coming to the posterior part, and here bones is going to the anterior part. This is the anterior pelvic tilt, this is the posterior pelvic tilt. So here we can mention in that posterior superior iliac spine to anterior superior iliac spines. This is having two types, that is anterior pelvic tilts we saw previously in the images. The pelvis tilts forward with the anterior superior iliac spine lower than the posterior superior iliac spine, and posterior part, if you are seeing that pelvis tilts backward with the anterior superior iliac spine higher than the posterior superior iliac spine. Thank you. Thank you. In this video, during diameter, I said that anteroposterior diameter, from how to take it from sacroiliac joint to pubic bone, the lower part of the symphysis pubis. In that, why we have to take it that sacroiliac joint means during the time of delivery, that coccyx bone it's moving back. I said previously that pubic bone is stronger. Coccyx bones it's movable back during the time of delivery.